questions you got about like using aiding equipment you were talking about?
Yeah, I've had that come up a couple times over the last month and a couple of times more recently as well. Some examples being someone asking, well, is it okay if I wear like a back brace while I do exercises or while I work out? Had questions about like, oh, is it okay if I have like a little foot lift to help aid? So these are just questions that people get, they come to me with, and I've had some thoughts on that too, but that's something that we can kind of hash out.
Yeah, for sure. So how did you answer that question? What did you tell your clients, like with the heel lift or with the back brace?
Yeah, so I think I go back to, well, the example being if somebody comes up saying, oh, well, should I take Advil for my pain or something? Well, it's like, well, I'm not your
Mhm.
doctor, so I'm not going to tell you not to do it, but with the mindset of like, we're here to minimize things that you feel like you're reliant on.
Yeah.
So my mindset for them was, if you feel like it helps, fine, that's great. Do what you need to do for now, but just know that that's not what we're looking for. We want you to build stability. It's giving you a false sense of stability. So try and make the mindset of do what I can and we'll take what we can get. And we'll help you with things outside of that if you have to, but with the mindset of moving away from that. So that's kind of the direction I try and push them without giving them like a hard yes or no to type of that type
Right.
of stuff.
Yeah. I gotta say, like, I agree that we want to move away from relying on those aids, like you call them. And I think an important thing to remember is why. Like, why do you need it right now? Like, why are you in a position where your chiro or your doctor gave you a heel lift? And the heel lift is such a great example because I feel like it's pretty common, at least for us here, to have some of our clients say that they've been told like one leg is longer than the other and they've been given a heel lift or orthotics to change that position. And that's usually like what I'll start to go towards, right? I'll ask them like, well, do you know why you have it? Like, why do you need it? And some people don't. They just, I was given it, so I use it. And, I feel a little bit better when I have it in, so I've just continued to use it, which is fine. But then, we dig into that. So usually when people are told they have one leg longer than the other, most of the time we have found that really, if you follow the chain all the way up to the hip, comes from a hip discrepancy. Like one hip is higher than the other. So it's not necessarily that your bones are different lengths, although that is possible. It's not as common. But there, to that point, there is the possibility you could have one leg longer than the other if the bones are different lengths. If you had a bone break, if you had like a surgery or a procedure done when you were younger, like there are a variety of reasons where there could be. But more often than not, if you check your hip levels, if you just put your hands at the top of your hips, you're going to have one higher than the other. And if we can bring one down so that or bring one up, whatever, get them to the same height, then you probably don't need your heel lift anymore and your legs will be the same height. I actually had a client, like, she told me that she had a heel lift and it was a goal of hers. Like, once we explained it that way, she was like, oh, wow, okay. So if I can make the changes from within my own body by using my muscles to move my bones, then I won't need a heel lift. I'm like, yeah, I mean, you shouldn't. That's the whole point, right? And we worked on it, and a few months in, just didn't have to use her heel lift anymore, which was really cool. It was actually like a really big deal for her. So
yeah, no, that's amazing. And yeah, so it's not always just people coming to us being like, oh, should I try this? Do I need that? It's the inverse,
yeah.
where they start off coming in with something. So we had a similar example, but for the back brace, this guy, really bad back pain. He felt like he had to wear this back brace to even feel comfortable. He was ironically a spine surgeon himself, years and years of issues, but that was the only thing that reduced the symptoms. I work on his feet all day. He felt like, I'm gonna have to switch careers unless I solve this. So he thought his best solution was to wear this back brace, and he felt relying on it because he's like, getting that extension, standing upright, reduced that. So I would say the one positive out of that was he experienced what that position can do for him in terms of minimizing the symptoms.
Yeah.
So we took him through our process of, well, we don't want to rely on that. Your muscles are what can hold you in that place. So that's what we're trying to get you to. And slowly but surely, he weaned off. He would wear it maybe 50% of what he did before, and then 40. Now he's probably 100% off, and it's been fantastic. So cool. Yeah. So the upside to things like that is it lets you experience what it's like and what it could feel like in the proper position posturally. But you feel free from it when you can then not need it. So it was amazing having him kind of get back to feeling like his own body can get the job done for him.
Yeah, that's such a good point you made. Like, when you do wear the brace, it helps you feel what that position is like. And that's really, really good point. And you can use that as a test even, like, or if a client like your client is already using it and is like, this is when I feel good, then you can dissect that further and be like, okay, if this is what makes you feel good, let's think about that. What's changing? It's changing the position of your body, you know? So we know that that's the direction we need to move. We need to get your body in a better position. Let's just do it with your own muscles instead of a brace. Oh, yeah. That's awesome. That's so cool. And how funny that he's a spine surgeon. Did that, like, how was his reaction to that?
Well, because he had discussed this with his colleagues, like, what's wrong with me? And they all had all these different answers. And he felt like he knew what his problem was, but no one would listen to him. So he was very in tune with like what he felt, and he's tried everything. But yeah, it just came down to something simple like that he just needed a little push, but he was headed the right way, I thought.
That's awesome. Yeah. That's super cool. Well, congrats to him.